we are Australia's largest and still fastest growing group. We have locations all across Australia. We have hundreds of staff, and we are looking for like-minded individuals who want to make a similar impact in the communities they live and work in.
I was drawn to Back in Motion at first because I trusted what I'd heard about their brand in terms of being clinically excellent and making clients happy. And coming to work here, I certainly have found that, which has kept me here for 2.5 years. And I still feel that I'm constantly being given opportunities to challenge my skills and extend them, and to grow as a physio in both a clinical capacity and, if I wanted, certainly the non-clinical area.
Our scope of services are very varied and wide, and I think for someone like myself who has had experience as a clinician and now have grown my own professional development in that time, I think having opportunities in a clinical setting and even in a management and business development setting, I think just appeal to me quite a bit. If I look at my history, I started as a clinician in a practice. I moved on from there. I got involved in managing a practice, the corporate health environment. I also oversaw and managed a number of practices in our company network for a period of time. And now I'm back in the director's seat at Montana. So just having that variety that I don't think we would necessarily get in a private practice physio setting outside of Back in Motion. So for me, someone who needs change, variety and development, I think that's why I've been here so long.
I describe myself as something like a reluctant practice owner. I never really wanted to run my own business, let alone a health group the size that we have today. But what I was really frustrated with was the reactionary healthcare model our profession tended to adopt. And so we started the group with the intent of giving patients a holistic, evidence-based solution that was much more than just managing their pain. And so we kind of steered away from quick fixes.
Well, I think I'm a great example of the career opportunities at Back in Motion. I started off as a physiotherapist in one of the private practices. But then I found that my passion was really in aged care. So along with Jason Smith and a couple of others, we helped to start Revita, the aged care division of the Back in Motion Health Group. So I've transferred over from private practice into aged care. And I think that's also the great opportunities that are out there for people wishing to join our health group, that you can either work in private practice, you could work in Revita, the aged care division, or an Active, the corporate health division, or a combination of all three.
Because it's such a large business, it's good to be able to not only do your physio thing, but also be involved in other aspects of the business like marketing or sales and finance, things like that you wouldn't ordinarily be exposed to in a private practice situation.
The reason why I became a private practice owner and I worked for Back in Motion purely and simply was to make a positive impact in people's lives. And the way in which I've been able to do that is work in conjunction with our health foundation, the SOS Health Foundation, which is a charitable organisation that allows us to provide health services to remote communities in Palm Island and Gove, as well as set up pro bono clinics across 3 capital cities across Australia. And that's really what I'm passionate about, and I'm trying to make a positive impact in people's health.
I think Back in Motion offers a really unique opportunity for experienced physiotherapists. We have a rich talent pool, probably unmatched anywhere else in the industry. Hundreds and hundreds of very experienced staff whom you can tap into and receive personal mentoring, as well as be part of think tanks and larger forums. I think also we have choice. One of the best things our group provides is choice in your career pathway. You can pursue clinical excellence if that's the real desire in your career. You can pursue health management, or you might even want to pursue ownership within your own practice. And so there's a number of different pathways that you can go down. And I think for advanced clinicians, really what we offer is an unmatched level of professional development. We financially support postgraduate education. We create flexibility in your work hours because we want to really encourage those to pursue the greatest heights that they can reach.